MARCoNS, the most frustrating part of CIRS. How the heck do you get rid of them? Learn where most people go wrong. I'm Dr. Lauren Sparks. I'm a doctorally trained nurse practitioner. I'm also a therapist. I've walked through the fire of erythromelalgia as well as chronic inflammatory response syndrome. I'm here to tell you I have hope for your healing. Lots of it. So MARCoNS, step 3 of Dr. Shoemaker's protocol. 80% of us with a diagnosis of chronic inflammatory response syndrome are also positive for a MARCoNS colonization, meaning that they have over-colonized in our nasal passages. MARCoNS are something that live on the skin microbiome in small amounts, but when we have the drop in MSH that we often have with chronic inflammatory response syndrome, they become these opportunistic infection in our nasal passages that can really drive toxic effects on the brain. They actually drive brain-based symptoms as well as fatigue. So they sit high in the nasal passages. We usually have that elevated MMP9, which leads to a leaky blood-brain barrier. And it's not a pretty situation with the leaky blood-brain barrier and MARCoNS sitting high in the nasal passages, releasing polycyclic ethers and toxins that can easily cross through that leaky blood-brain barrier. I want people to understand that if you find out your MARCoNS positive, it's a marathon and it's not a sprint. We benefit from suppressing that MARCoNS colonization, even if we're not completely clearing it. And so we want to be consistent with whatever treatment we are prescribed. EDTA is the most evidence-based treatment for MARCoNS. Your provider may determine for some reason that another treatment is more optimal for you. Regardless of whether or not it's EDTA or Xlear or some other treatment, consistency is key. We want to treat MARCoNS treatment as if it is an antibiotic. We want to do morning, midday, evening. If we miss a dose, let's say we do it first thing in the morning and it's 2 o'clock and we realize, I forgot my midday dose. Go ahead and get that in as quickly as possible. Don't wait until your next dose. This is the consistency that will help you eventually clear MARCoNS. I want to talk about something I feel like is a misconception where people get pretty frustrated. So you start treating MARCoNS after finding out that you're positive. Your provider has you repeat a MARCoNS swab. Before you speak with them, you often will get that report back and you are still colonized and you will feel frustrated. And some people at this point will stop treatment. And this is really when a patient is shooting themselves in the foot, to be quite frank. Often, when we compare those two MARCoNS reports, what we see is that the resistance profile has changed. And that means that somewhere along the way, you did actually clear MARCoNS, but you have recolonized with MARCoNS. And this is a good thing. It means you have the ability to clear. And you're likely just recolonizing because your MSH isn't high enough yet. And so what I would encourage you to do before you jump ship, shoot yourself in the foot, stop MARCoNS treatment after being very consistent, take those two reports and compare them. When you look at a MARCoNS report, you will see underneath whether or not you're positive or negative, you'll see this resistance profile. And you'll see a lot of R's and I's and S's, meaning resistant, sensitive, etc. All you need to know is you want to see a different order of R's, I's, and S's on the first MARCoNS report versus the second. It doesn't matter what it is. All we want to see is that it has changed. So for instance, if the first report says RIS and the second report says RRS, there was a change, and that is encouraging. You have had a change in resistance profile, you have cleared MARCoNS somewhere during your treatment process, and you simply recolonized because MSH was still too low. We think MSH to rise somewhere above 25 before you will actually be able to clear MARCoNS and maintain that clearance. If you see that you have cleared MARCoNS, you're one of the lucky people who have cleared MARCoNS, and you see that on the nasal swab. Also, don't stop your MARCoNS treatment until you meet with your provider. And that is because if MSH is less than 25, many providers will still have you do some sort of preventative prophylactic treatment so that you don't recolonize, so that you don't undo all of that hard work that you did treating your MARCoNS. I hope this clears up some misconceptions about MARCoNS. I hope it adds a little clarity to the clinical picture. It's not simply as easy as you've cleared or you haven't. Instead, we are interpreting whether or not there is a change in that resistance profile, and that is an important piece of the puzzle. Another challenging part of the protocol is step 1, which is removal from exposure. You can learn more here. If you're benefiting from this channel, please like and subscribe. Feel free to add your tips and tricks and your own hard-won wisdom. If you have a question for me, post it below. And until next time, take good care and hold on to hope.